Okay, let next one, yes. Yeah, I was just saying that I really like to kind of hear what more take was on the MOA personally, before we vote on it and, that equipment. But you know, too much of it behind the table until, if we're signing legal documents, probably got to have a attorney. Yeah, but that, I know y'all need those issues, but that might be the best course of action.
That is fun. Absolutely.
That makes, anybody else, I was also not nice on that.
Okay. And then the last thing on my section tonight is just presenting the Work First annual agreement that we do every year. So I know Commissioner Steve and I spoke about that also. So that is the only thing really that I wanted to present tonight was these two items, and then we'll let the other folks present their information. So unless you guys have any additional questions for me.
Are you guys all satisfied? No questions on the delegate authority?
Yeah. Not at this time, I'm sure I'm not asking later.
Okay.
Yeah, I think we need to do that when it comes up under NA.
Okay.
Like the motion being, instead of doing it now.
Yeah.
Okay.
Sounds like you're fine. Sean. Yes, it's your turn.
Good evening.
Good evening.
Last month, we talked about, having a little bit of discussion about our out of county kids and some information on that. So if you want, we can start doing, just hit APS stuff real quick, and then we can come back to the CPS. For that extended discussion if you all are out there. Looking at, APS numbers. So for, July, we had 11 reports come in. 7 of those were screened in. We currently have 7 cases that are currently being assessed. We have 7 cases that we're doing case management with. We have 2 cases in special assistance in home. 12 continue having 12 payees. We've got 16 wards at this time. That's 1 down from last month. We had one of our wards unfortunately passed away. So we're down to 16. Currently, we have 2 facility complaints, and we're currently doing an ongoing assessment on those 2 complaints as well. The child subsidy, that's been shifted off of us, just to show you that we do have 88 kids under child subsidy at this point.
How's that working, Sean?
So far, it seems to be working. I haven't heard anything negative, so we're going to continue to assess that. I think our what we talked with them about is meeting again in about 30 days, just to regroup on that, just make sure, hey, is there any gaps that we see in, and any adjustments that we need to make in that area.
When did that just started this month, is that correct? Or-
July.
Okay, so, I mean, are we anticipating we'll probably see an uptick in some of those, as time goes on, this child subsidy? Children being served, or?
I mean, we're pretty, compared to the surrounding counties, we serve a lot of kids. Compared to the surrounding counties, so we haven't seen a shift in that. I think our concern is if we've seen a significant shift, especially a significant shift in reduction in the number of kids served, then we would be like, okay, what's going on there? So
I was thinking there might be a positive shift because they're incentivized to, serve kids with that child subsidy, right? According to
it's kind of like you got only so much money
right.
too. So you're kind of boxed in by the amount of money you're allocated
From the state.
through that process. So, but we're hopeful that's going to be a good solution for us, but we also want to monitor to make sure that our citizens are getting the services that they deserve. And if we feel like they're not, then we want to readjust on that. Shifting to CPS, the number of cases or number of calls reports that came in for July were 18. We screened in 8 of those, and we, at the end of July, we had 13 open assessments or investigations ongoing. We also have currently 5 families in the in-home services. Looking at the total number of kids in foster care right now, we have 47. We've had, as you can see, we're on an increase in the number of kids in custody right now. We've just seen multiple situations, primary drug related, that we're seeing an uptick related to. So we had 3 additional kids in for July. We have 8 kids cleared for adoption. We had an additional child cleared for adoption. That child that's cleared for adoption is actually already in a pre-adopted placement, and we're hoping that potentially either this month or next month at the latest that adoption will be finalized for that child. So looking kind of last time, one of the things we talked about was the number of kids that are out of county, and that number is pretty high. So if you're looking at that number, showing 2027, we actually just had a shift because we had a kid that just went into a residential program, so that's out of area, so that's actually at 28 now. But 3 of those kids are 18 to 21, and they're out of area because they're working in different locations. So if you're looking at kids that are actually what you consider in foster care, 0 to 17 in foster care, we actually have 25 kids that are out of county in that category. So the numbers that we're kind of discussing is that 25 number. So did some just analysis breaking down those 25 kids. Out of those 25 kids, we have 9 of those kids are in a therapeutic setting, whether it's 1, 2, or 3, they're in a therapeutic home. We have 2 of those kids in a PRTF, so that's like a psychiatric hospitalization type level. We have 7 kids that are out of the county placed with relatives. We have 1 child that's out of county placed with a non-offending parent. And then we have 1 child who's currently in the custody of DJJ. So that makes up those 25 kids as far as their placement arrangements. I'm sorry, I forgot. We got 1 child in an independent living kind of group home setting, and we have 4 kids in a regular group home setting of those 25. So that those numbers will be the 25 number. If you look at age range, out of that 25, 13 are teenagers, 13 or over. We have 5 kids that are 11 to 12. So total 18 of those 25 kids are either preteen or teenagers, which is again one of our challenges. So you look at a combination of not only are we looking at a majority of these kids being preteen or teenagers, but they're also in the need of therapeutic type levels of settings. So that's kind of where we're at. I know Commissioner Hardin had looked at what is kind of the impact financially on that as a county. So really, when you're looking at really where the financial impact is, it's the kids in the group home. So it's those 5 kids that are in the group home setting, and 1 that's in the independent living group home setting, and then the other 4 that are in the regular group home settings is kind of where the impact is financially for us. All of those kids are, they're not 4E, which means they don't qualify for any federal funding. So it's all state and county. So it's a 50-50 split between state and county. So you're looking at an average of around $2,346 per kid per month for those settings. So you're looking at an average cost of around $11,730 a month to house those kids outside of our county. Now what that does allow us to do is keep siblings together, and also just provide with teenagers. There's nobody that wants to really take our teenagers, so group home settings end up being the default for that. So that's kind of the scenario that we're in. There is some additional costs. Some of these kids that are in the therapeutic and in the PRTS, they're placed throughout the state, some all the way over on the East Coast. So what we do is we try to streamline that. We have to see those kids each month. So one of our workers who happens to just be assigned to the majority of these kids he kind of hits all these kids at one time. So he'll do 3 or 4 visits in one loop. It does require him to stay overnight. So he'll go all the way out to the East Coast, see a kid, spend the night, and then hit several kids on the way back. So we're not doing multiple trips. We're trying to, make that as limited as possible. So you're looking at an additional cost of around $300 a month when you look at room, getting a hotel room and then the per diem. And of course, the travel involved with that as well.
And your PRTF kids are, correct me if I'm wrong, in this shop, that's your kids that's going through like multiple placements usually.
Usually they belong to multiple placements. Their level of need is the highest. It's the highest setting that you can get within our state as far as placements. These are locked facilities. And so they're meant to be short-term as much as possible because they're meant to be a kind of acute care, get them in there, get them stabilized, and then reduce them down into a level 3, level 2, level 1, then into hopefully back into a regular foster home or a group home, regular group home setting.
So if you let your PRTF, that's the right acronym, right?
Yes.
Those are your kids that require like the most intensive level of care, and it would be probably inappropriate to place them somewhere else.
Right. And so that, and the good thing about the kids that are in the therapeutic, the 9 kids that are in the therapeutic level and the 2 kids that are in the PRTS, Medicaid covers those expenses. So there's no cost coming from the county on those kids. Really, the only placement costs are the group home costs.
And we have 5 kids and
And we have 5 kids that fall under that group home.
All those group homes fairly close to Mitch County.
So we're looking at Crossnor and Blackton. So both of them are the closest group homes that we have to our location. Then talking about, foster care and foster care placement, we do have currently 4 families in the training. Further getting training, we're up to 13 homes. We have licensed an additional homes. So we're at 13 homes with 4 families in the training process.
it's our live stream isn't functioning tonight, which is kind
It
of.
is now.
Oh, is it now?
You're live, yes.
Great, all right, so well, this is a perfect segue, so I think it'd be safe
That's all right.
to say that, anybody that's interested, that's listening and becoming a foster parent, there's a pretty decent need for respite foster parents as well. So like if somebody can commit, can you explain that?
Yeah, so I mean, it's one of those things I think that people sometimes don't understand that you can actually become a foster parent, but there's different levels of fostering that you can commit to. You can do emergency fostering, basically for those kids that come in, in the evening, on the weekends or something like that, when we're trying to work out placement so that they're only maybe in your home for a couple of days. Respite, which basically you're backing up other foster parents. They may need to be going out of town for some reason, or they have a family emergency and they need someone to step in. So you can choose just to be a respite home, or you can be the traditional foster home in which you're going to have kids long term. So there is a lot of different ways that people can serve, and we welcome any of those. Obviously, anybody who wants to be a foster parent in our community, we're going to wrap around them and get them through the fostering process. Obviously, our need is teenagers, which is the greatest, difficulty, and we recognize that is a huge ask. But that's obviously, where our greatest need is, along with sibling groups. It's one thing for us to call you and go, hey, we have a kid. It's another thing to us to call you and say, hey, we have 3. That's a big ask, and we recognize that too, but we are looking for those families that are willing to, if they're able to just step up and provide those level of services as well.
And I guess the issue, Sean, that you guys run into sometimes is if kids come into custody late, like Friday night, a lot of your homes where you place kids don't have staff on the weekend. Is that accurate? So do an intake of the child, or?
A lot of times, so if you're looking at group care, or you're looking at those types of residential type of placements, those are not emergency placements. They send us your information. We're going to review it with our team of people, and then we'll let you know. Well, calling them at Friday night at 5 o'clock and going, hey, I've got a 14-year-old, they're basically, well, send us the information, we'll get back to you on Monday when we look at it. So that's one of the things that across our entire area, our region, does not have any emergency type placement. So not only is Mitchell County, does not have access to that, none of the 14 counties in our region have access to that emergency type situation. So we're kind of all in the same boat. Especially with those older kids. Although we do have a couple of homes that have done that for us, and we're very thankful to them. But it's one of those things where when you only have 2 homes and you're always calling them. It's, it kind of gets, we want our pool of foster homes to be as broad as we can get. So again, if you are interested, please just give us a call and we will certainly sit down with you and go through that process with you. And the current process we're using and we've used now since probably about 2020 is the one-on-one training. Instead of trying to do group training, we find that families trickle in. And what we don't want is to put a family on a waiting list and have them sit on a waiting list for 6 months, waiting on getting enough people to do a group. So what we've done is we've shifted our training one-on-one. You can come to the office, or we'll come to your home. And that's been extremely successful. We're able to work around your schedule instead of someone trying to fit into our schedule. Mission.
Thank you.
No, you're welcome.
Thanks, Sean. Miss Tammy.
No,
Everybody. So I have 2 things to report tonight. I wanted to kind of talk about last year. I gave everybody a year-end report with all of our DSS budget accounts on it. I think I gave you the same thing last year. And I've been working with all of the numbers to get all our costs and revenues in. And as far as DSS budget goes, I think all costs and revenues have been posted for last year. So I'm excited to say that puts us all programs at around 89.5% budget for expenditures. So I'm excited about that. Last year we came in under at around 95, just over 95. So we did pretty good, and we can contribute that to good coding, careful spending, and moving money around where we need to move it around. So, our revenues, we came in slightly under for last year, just almost at 98, 97.6. You'll see it on your paper. But you're going to see that when you're in a reimbursement system, your cost is lower, your revenues go down. So I'm pretty pleased with what we did last year. And if you don't have any questions, we can talk about July. Do you have any questions for me about this report that I made?
That's Commissioner Pittman asked for a while back. They're not for 10%.
Yeah,
There's
there's your 10%.
Yeah.
I didn't know they could be done, so.
That's pretty damn close, yeah, that's right.
So yeah, I'm excited. I hope we can do it again this year, although we're starting out July with some challenges. So our overtime bucket got hit pretty hard, and you'll see that in the other July reports that I gave you. So we're starting out July a little over at 10.7%, where we should be at 8.3. So, but that's going to happen when you have overtime hit and the challenges we faced.
So we're only 2% over on our overtime.
We're 2% over all expenditures, all programs for July for DSS. Yeah, we are gonna have to look at that overtime budget as the year progresses. Hopefully, we won't be hit with this last challenge of having staff around the clock. So that's it. And of course, there's no revenues yet. I just did my report today with sending it into the state. So next month, we'll know what we brought back in reimbursements for July.
Is that around the clock need changed?
Yes, right now. Right. Any other questions?
Good job.
Thank you.
That's right, the whole agency. That's
I was extended amount of time for that around the clock need, but
Yes,
Yeah.
it hit in June and then in July.
And am I looking at this correctly, that, total down pay is about 0.4%.
Okay, I think we're gonna address some of that. Yeah, we're gonna talk about some of that in personnel later. I think we'll answer the question, but you got it.
Well, I mean, I'm just saying, okay, you're 1 month in, I.
Yeah.
You know, overhead some money's gone.
And we did budget low for overtime. If you look at our overtime costs for last year compared to what we budgeted this year, we did have to move money around last year to cover overtime. So we did that within our DSS budget. Hopefully, we can do that as the year progresses on, but we're substantially lower. You see the difference. So that's why it's coming in looking really high. Last year, we budgeted 47.5, and I think we're just at 16, 15 right now. Okay. Anything else? Thank you for your time.
Mrs. Michelle Hobson with our Medicaid expansion.
Good evening.
Good evening.
We've been getting updates monthly on Medicaid expansion. It's been challenging getting those updates as the state informs counties. As you all know, the House Bill 76 was signed by Governor Cooper back in March of this year to expand Medicaid for the state of North Carolina. So last month, Department of Social Services received notification from DHHS that the proposed launch date is supposedly October 1st, pending approval of the state budget. Now that is hopeful if the budget is passed by September 1st. If the budget is not passed by September 1st, then it could delay the implementation by December 1st or at the latest the beginning of 2024. So with Medicaid expansion, for the projected number of cases for Mitchell County, we are looking at an increase of 900 to approximately 1,000 additional cases. So for our caseworkers now, the average is roughly 380 to 400 range now. So lead workers can't carry a full caseload because 20% of their time has to be second party reviews of the staff that they manage. So they cannot carry a full caseload. Okay, so those additional staff are having to compensate for those additional cases from that lead worker. So with the projected increase of cases that Mitchell County is looking at, this will propose at least 1 to 2 additional caseworkers. Now the county has graciously approved our first position, and we're very thankful and excited about that. We do have some concerns that once we start working these cases and expansion is implemented, that we might need to propose that second position. It's just hard to know right now because once we start working on these cases, the amount of man hours that the caseworker is going to be involved, it's going to be an additional program that we're going to have to evaluate these clients for. So it is going to take longer than just working a normal case as it is currently. So once we start getting into the meat of expansion and working those cases, then we'll have a better outlook on that second position that we may need to come back and propose for.
Do you ever, Michelle, do you guys ever like work directly with providers? I don't guess you.
Yes, we do. We work a lot with our providers as far as submitting applications. We work very regular with Blue Ridge Regional Hospital, McDowell Hospital, Mission. Very seldom do we get applications from Ballad Health.
Okay.
Out of Tennessee.
Right.
Mainly it's our HCA hospitals.
Do you think our provider network here how are they, I guess, responding? And you may not be able to answer this question to kind of, I guess they're gonna have to expand as well.
Yes. So we had a meeting actually last week at DSS, and we had a lead nurse come from Blue Ridge Regional. She was suggesting that the next monthly meeting that a case manager would come to, provide input on where they're at with expansion, how closely they're following, how they're prepping for the launch, pending the approval of the state budget. So she could not really relate as far as where they stand at the hospital standpoint. But hopefully at next month's meeting, she'll send a case manager that could provide more input on what the hospital is doing to prepare. Now, with previous months, our local hospitals have been short-staffed with medical assistance counselors. So they have a counselor at Asheville. We have one at McDowell, and we've recently been notified of one that's come to Blue Ridge. So, and she is fairly new. All of those medical assistance counselors, they're managing at least 4 to 5 counties. So it's going to propose an increased workload to those medical assistance counselors as well, not only to the local DSSs. So with our new staff, they will be responsible for handling the additional workload as a result of expansion. They will be handling new applications for Medicaid. They will be handling the annual recertifications, and then any changes of circumstance. With changes of circumstance, that is changes that the client may have reported or may have been reported by another unit within the agency, such as food and nutrition, with children's services. If the child has been removed from the home, that we have to reevaluate the household income based on the amount of household members. So they're going to have to be trained on all 3 of those categories. So right now, since COVID waivers have ended in March, if that client is ineligible for Medicaid, they are terminated. I mean, they've been in place for, COVID waivers have been in place for 3 years, 3.5 years. They've had to remain on their current level of Medicaid coverage. So now, not only are we bracing to gear up for expansion, but since April, we've been trying to get back to a normal way of life. The way normal Medicaid policy was, if they're over income, if they can't meet a deductible with any outstanding bills, their Medicaid benefits will terminate, or they may go to a lesser coverage like family plan. So with expansion, if that happens, then if they're at risk of losing their Medicaid coverage or they're ineligible, we could look at them under expansion coverage, in which they could possibly meet the guidelines.
Might be showing my age here a little bit. Didn't we used to have a program called NC Health Choice that would?
Yes,
That's gone. correct?
NC Health Choice is now, it's dissolved. It's no longer a Medicaid program for families. Yeah, it's been in place for years, but yes, it has now dissolved.
Does this also affect, this change, is it gonna affect your primary care providers like your individual doctors?
They could see an influx as well. They may be seeing more patients that may not have been eligible for Medicaid under normal policy, but with expansion policy, they might be eligible. So they could see an increase in patients. So it's going to be a trickle effect.
Could that doctor choose not to see these patients that are on Medicaid and they would have to go to another doctor?
Yes, it is the medical provider's discretion currently if they want to be a Medicaid provider or not.
Yeah, would you say the majority of ours are? And
Majority of our local ones are Bakersfield Clinic, Ozzie Phillips. A lot of our local ones are Mitchell County Health Department. They currently are Medicaid providers. And then we have some in our neighboring counties, like our Avery County Health Department, McDowell County. We have a lot of Medicaid providers there as well. So, but it is the medical providers, discretion. If they no longer want to take Medicaid, they are not required to take it.
I think this conversation went on, almost like 3 years ago, maybe 3.5. And I know the concern then was trying to get everybody connected to this.
Right.
But the biggest concern that I remember that Ms. Jones may have used this primary provider up here, this doctor.
Yes.
Doctor says, well, I'm not doing this anymore. Then that individual have to travel possibly to Tennessee, or further down in the state to the Hickory area or the Haywood area to be seen. That was a huge concern. So this sort of entails the same thing, if I'm understanding this
Yes.
correctly.
Yes, it could, most possibly. We run into a lot of that issue with dental providers. They do not take Medicaid. So they're having to look at neighboring counties or a little bit counties further down into the state to see if they take the Medicaid to get those dental services that they need. So just trying to see if they are going to honor, once expansion is launched, if they're going to be a provider and accept that coverage to see those patients. And if not, those clients could have to go to get their medical care somewhere else. So it is a concern. It's a great concern. However, it could serve more of our 21 to 64 age group populations that may currently not be eligible for Medicaid now. They don't necessarily have to have a child in the home. They are going to be their own set of income guidelines for expansion coverage. This is a whole new policy manual that's in the process of being created. It's not ready to be released yet. So not only is our new staff going to have to be trained, but our current staff is going to have to be trained on expansion coverage as well. So that's what we're waiting to be released so we can get that training and start moving forward with that. Because we need to be prepared for when it does. So we are expected to see an influx in applications. Right now, Medicaid applicants can apply in person. They can go online and apply through ePass. They can do a phone application or mail. So we are expected to see an increase in applications. We are now currently starting to get calls about expansion, but we're having to remind our clients that it is not launched yet. So they are getting anxious, and we're just, waiting for more phone calls to increase, in-person traffic, foot traffic to increase as well within the age.
So I need an appointment for the in-person.
No, they have the right to apply at any time. They don't have to have an appointment to see a caseworker. They have to be seen.
So to kind of sum it up for the public, Michelle, Medicaid expansion's been signed into law, but funding has not been.
Right, and that's a lot of concerns that counties are facing. Some counties are going ahead and hiring for their expansion staff. And, with expansion not fully launched yet, and that funding, a great issue. With us, we have sort of been reserved. We're taking it slow instead of jumping the gun and going ahead and posting, for a new person, because we could go ahead and post for that position, but then it might be, postponed until 2024. And there we are stuck with having to come up with the cost for their salary and their retirement, their insurance. So that's the reason we've sort of been, reserved, and we can attest to that as well. And Tammy, we've met about this on multiple occasions instead of just jumping the gun and going ahead and posting for that position.
That seems to have been the right call.
Yeah.
And then on the flip side of that, you talked a little bit about the delegated authority. So let's say this thing does flip and go in pretty quick. Then you're in the process of taking the application. You got 2 people in the whole state of North Carolina looking at applications. So you may have somebody that you like to hire, but you can't hire them for 2 months because they've not okayed and brought them back in. And then this thing flips, you don't have any workers process it.
And in our standard application timeframe that we have to have those applications worked by is either 45 to 90 days. Now that 90-day application is mainly for our adult applications that are pending for a disability decision by the state.
So, Michelle, the Commissioner Harding's point, as soon as the budget is passed, is Medicaid expansion.
Within the 30 days, based on the calls that me and Wendy have been on, within 30 days. So if by September 1st, we have, notification that the state budget is passed, they're telling us within 30 days that expansion could launch. So that would make October 1.
But now this has been going on, I think. And maybe some of it's passed and I've just been in the smoke screen. But I think this same conversation's been going on for 3.5 years, and here we see it.
Mhm.
Yeah.
So that's, we've just sort of been holding our breath. It's been very hard from the beginning, getting more information to sort of prepare. From county standpoint, being proactive, but at the same time, sort of erring on the side of caution and not going ahead and, posting for that position and then the funding being postponed. And then there we are with that salary costs or benefits that we have to come up with to pay for that position. So, but we are expecting to see a great influx. We're starting to get those calls. We know that those are going to continue to increase. We've got one client that calls about every 2 weeks, getting updates on expansion. And that we're going to see that more and more. So far right now, the in-person foot traffic hasn't increased greatly, but once it's launched, we do see that increasing greatly.
And could I get your numbers again? I think you said 900 to 1,100 new patients with that
900 to 1,000 estimated cases.
total cases.
Yes,
Okay.
for our county.
And that would give each worker, did you say 300 and
Well, that would give them right at about 450.
450?
Yeah, and that's,
Right now.
they're right at 400 now. So I mean, that's a lot. So
How many
we foresee,
workers do you currently have that's doing this?
okay, so with adult Medicaid, we have 4 caseworkers. With family and children's, we have 5, and that's including lead workers in those numbers.
So that's 9 workers, and those 9 workers are carrying about 400.
Close to 400, yes. And that's a lot for our county.
Yeah, it is. I mean, how do you process
Mhm.
that many cases?
Now with adult, unfortunately, we have some that, that pass away and that decreases their numbers. We see that more frequent with adults, like our long-term care and essay cases more than family and children's. So some months we may have some, 1 to 2 people that pass away. Then during COVID, our numbers greatly reduced. So
Does the 400 people, is that counting the additional employee you will hire or?
no, that's currently what we have. Now, if you need exact numbers per caseworker, we can pull a report and provide that to the board. If you would like to see those exact
I'm
numbers,
just sitting here
that's just the estimation.
astonished from taking it back. Big one.
Yeah,
I
it's
think,
quite alarming.
I think they're, asking for that one additional worker. I think they're being, I think RH is trying to be conservative and kind of always, I guess, the toe in the water. I don't know.
Yeah, and I mean, right now, we know probably, 90% will have to come back and ask for that second position, that we're just putting one position at a time until we know for sure how this is going to roll out. With North Carolina Managed Care Tailored Plan, that provides enhanced intellectual and behavioral health services to our Medicaid recipients. That was originally scheduled to launch October. This has been postponed on multiple occasions.
You're talking about the Taylor plan?
Yes.
And I think that's what Jeff was referring to, like this is going on 3 years.
Yes.
Yes.
So, they have postponed that to where it will not start October 1st. A new launch date is to be determined, and that's the latest update that we have received. So as we know more, we'll update the board more, on that official start date.
How are we still functioning as a nation? I have no clue.
Yeah.
I mean, this is
Yeah.
ludicrous.
On the last topic tonight, I want to notify the board of our on-site visit that will be from the enrollment broker for North Carolina Managed Care and Via Health. They will be at DSS on Wednesday, August the 23rd from 10 a.m. to 3 p.m. We have event flyers that's posted on the DSS Facebook page, our county website. We're working on getting that event flyer posted there as well. If you are asked about any Medicaid questions, please refer them to come to our agency on this date. It gives them an opportunity to talk to the enrollment broker about their Medicaid services. If they're unhappy with their current managed care plan and they're thinking about changing that plan, they can talk to that enrollment broker face to face. Valley Health, the representative will be there to talk about any behavioral health needs, any questions pertaining to that. So it just gives that face to face contact instead of on the phone or online. So we've been trying to do these every couple of months for that outreach. To try to give those Medicaid recipients that opportunity. Any
So,
questions?
Folks think they might possibly be eligible under expansion. This would be great. The 23rd from,
The 23rd is mainly based on managed care
okay,
enrollment issues or questions that they have. If they're wanting to change their health plan, like they might have Blue Cross Blue Shield, they might have AmeriHealth Care Costs. If they're unhappy with the coverage and the services they're getting under that insurance company, they can talk to that enrollment broker about switching that plan. With the behavioral health side of it, Valley Health can talk to them about those behavioral health services that they might be getting currently. And is there anything that you would like to add for Lisa on expansion? Any questions? I wish I had more concrete information. It's just been very difficult, not knowing exactly when it's going to start, how it's going to look. We're anxious to see this new policy manual, but again, it's not ready to be released. It's been difficult. We want to be proactive and be ready from an agency standpoint to serve our clients and new applicants that might be coming along. But it's just been hard trying to get that information to us. So
sounds like the motto for, Medicaid departments, proceed with caution.
and they are concerned. Our additional staff, you want to retain staff, and right now their caseloads are at a max, and their concern is, oh my gosh, I can't, I'm doing good to manage what I have now. And now they're talking about expansion. I don't know how much more, I can carry, and that's a concern to them, and I can understand that 100%, because our caseloads are at high numbers, so. Any questions?
Thank you, Michelle. It was very, very informative.
Thank you.
Thank you. All right, I think we're at item 10A, the delegated authority again.
I'll have to pay with that until I make
Made a vote on that? All right, all this thing in the table, you don't.
You said that.
Yeah, you take nothing over the table, get a second, any discussion, and then take a vote.
Okay, any discussion? All those in favor of table until the next meeting? And here, very short. Oh, thank you. We do have a need for a closed session tonight. Michigan County DSS board needs to go into closed session to talk about attorney-client privilege and personnel. We go into. I'll entertain a motion. We don't need the statute, right? No, I'll entertain a motion. We go into closed session or not?
Make a motion, we go to closed session.
The invitees, now vote first, or inviting, always mess this up. I'm sorry.
Oh, it's all right. If there's any discussion, then you vote.
So is there any discussion on closed session? All those in favor of going to closed session, vote by equal sign. Our bodies tonight will be the board, our clerk, county manager, county attorney, and Ms. Pam Thompson, Ms. Sean Block, and I think we're gonna go down to the other